Welcome to this educational presentation on guidelines for self-managed abortion, or SMA, with misoprostol. This evidence-based guidance was carefully developed by the International Women's Health Coalition, drawing on established gold standard protocols from the World Health Organization and FIGO. This presentation serves as a comprehensive guide for all pregnant people seeking to self-manage their abortion. Our goal is to ensure you have the knowledge necessary to make this process safe, effective, and entirely private. Let's begin by reviewing how to prepare. Before beginning the process, it's crucial to gather your supplies and review a brief safety checklist. Your kit should include exactly 12 tablets of misoprostol at 200 micrograms each. You will also need ibuprofen for pain relief, thick sanitary pads, and plenty of drinking water. There is one critical medical prerequisite. If you currently have an IUD in place, it must be removed by a healthcare professional before taking misoprostol. Finally, while you can do this privately, having a trusted companion nearby is highly recommended for emotional and physical support, especially for pregnancies past the 12-week mark. Let's take a moment to discuss critical legal and safety information. Depending on where you live, there may be legal risks associated with self-managed abortion, so it is vital to be careful about what you say. Please understand that medical providers cannot physically tell the difference between an abortion induced with misoprostol and a natural miscarriage. Furthermore, misoprostol is not detectable in standard blood samples. Because hospital personnel in some regions may report suspected abortions to authorities, know that if you seek hospital care, you are not required to disclose that you took medication. You can simply state you are experiencing a miscarriage. Now let's look at the instructions for Protocol A, which is designed for pregnancies up to 12 weeks. Step 1 is your initial dose. Place 4 misoprostol tablets, totaling 800 micrograms, either under your tongue or tucked into your cheek. It is very important to hold them there for 30 minutes to allow the medication to absorb directly into your bloodstream. After 30 minutes have passed, swallow any remaining bits of the pills with a glass of water. Please note that bleeding and cramping are expected and may begin as quickly as 30 minutes after completing this first step. If the pregnancy does not pass after the first dose, you may need follow-up doses. Wait exactly 3 hours after taking Step 1. For Step 2, if the pregnancy has still not come out, place 4 more tablets under your tongue or in your cheek just as before, holding for 30 minutes. Wait another 3 hours. If you still have had no success, proceed to Step 3 by taking the final 4 tablets in the exact same manner. Keep in mind that most pregnancies end within a few hours of starting the medication, and over 75% of abortions are successfully completed within the first 24 hours. For pregnancies between 13 and 24 weeks, Protocol B must be followed. Please pay close attention as the dosage per round is lower here. Instead of 4, insert just 2 tablets, totaling 400 micrograms, under your tongue or in your cheek. You will repeat this 2-tablet dose every 3 hours continuously until both the fetus and the placenta come out. If the placenta does not pass within 30 minutes of the fetus exiting, you should take 1 extra dose of 2 tablets to help your body safely expel it. Knowing what to expect can help you feel much more comfortable and prepared. Normal symptoms during this process include bleeding that is notably heavier than a normal period, which is why thick pads are necessary, as well as the passing of blood clots and tissue. You may also experience strong cramping, nausea, vomiting, diarrhea, or chills. These are standard side effects of the medication. Signs of a successful abortion include seeing the embryo pass and a noticeable decrease in pregnancy symptoms, like nausea and breast tenderness, in the days following. To be absolutely certain, you can take a standard home pregnancy test 2 weeks after the abortion to confirm. While severe complications are rare, it is absolutely essential to know when to seek medical help. Go to a clinic or hospital immediately if you experience hemorrhage, which means soaking through more than 2 large pads per hour for 2 hours in a row. Seek care if you show signs of infection, such as chills and a fever lasting more than 24 hours after your last dose. Severe belly pain lasting more than 24 hours, or signs of shock like steady bleeding accompanied by severe dizziness or lightheadedness also require immediate medical attention. Finally, consult a doctor if very heavy bleeding suddenly starts 2 weeks or more after using the medication. This brings us to the end of our guide. This evidence-based protocol was developed by the International Women's Health Coalition, utilizing the latest guidance from the World Health Organization and FIGO, and was thoroughly reviewed by medical professional Dr. Suchitra Dalvie. We share this information to empower you, because everyone has the fundamental right to safe, private, and effective abortion care. Thank you for your time, and please ensure you have the support and resources you need to stay safe and healthy.